A very good morning, dear colleagues. This video is about understanding what is polarity difference and how it is calculated through a practical case example. This is a case of 85-year-old lady suffering from terrible pain in the epigastrium. She is without food for the last 4-5 days, resulting in tremendous weakness. She might even need some intravenous glucose for the weakness. If she attempts to eat one biscuit or drink even few sips of tea, the pain increases. Pain is in the epigastrium and it's radiating to the back. If she tries to press, the pain shoots up. If she bends down to pick up something, the pain aggravates. But interestingly, lying on the stomach gives her relief. Hot fomentation makes her feel better. There is no pain if she does not eat or drink. The case is repertorized using Polarity Analysis software developed by Dr. Heiner Freiser from Switzerland. It is a free online web-based software available on his website. On repertorization, we see Bryonia and Kali carb have the highest polarity difference, that is 10. What is polarity difference? We see there are rubrics and corresponding grades below the blue line, and the opposite rubrics, that is the polar rubrics, and the corresponding grades below the red line. Polarity difference is addition of grades of the polar symptoms below the blue line minus the addition of the grades of polar symptoms below the red line. The software automatically calculates this polarity difference. You don't have to do it manually. Now let us add the grades for Bryonia below the blue line, which is 17. Let us add the grades of Bryonia below the red line, which is 7. So the polarity difference between these two, that is 17 minus 7, is 10. The highest polarity difference is for Bryonia and Kali carb. The remedies with high polarity difference have the best probability of relieving the symptoms of the patient, and this has been verified multiple times in the practice and has made my practice very easy. Next step is to read the remedies from Materia Medica. In this particular case, the pathology, old age, extension of the pain to the back, sensitivity to pressure made the choice in favor of Kali carb. You can read this from Borik's Materia Medica, which is what the patient received every 3 hourly in 200 potency. The patient started to eat next day, and within 36 hours of the remedy, the pain was 80% better. It is almost a month since the remedy, and she is free from pain. She was asked to stop the remedy when the pain was more than 80% better. I would like to share some physical symptoms of Kali carb taken from Essence of Materia Medica by George Mithelkos. These are the symptoms taken from Soul of Remedies by my teacher Dr. Rajan Sankaran sir. I feel modern homeopaths are missing out on the sure, reliable and clinically verified physical symptoms of drugs and delving into the mentals, which can be pretty confusing. Here are some physical symptoms taken from Kent's Materia Medica. Now, what does polarity analysis do is it eliminates few remedies, thus leaves us with very few remedies to choose from. Like for example, in this chart you saw there are few columns marked in gray. Those remedies are contraindicated. In my next talk, I will explain what is contraindication. This method is very simple. It gives consistent results and most helpful for beginners and busy physicians if understood right. Thank you for your time and attention.